Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Rheumatic fever and its secondary prophylaxis are based on the AHA regimen, that is American Heart Association. So first category is about the rheumatic fever without carditis. So there is rheumatic fever and this is without the carditis. So rheumatic fever without carditis. So what is the duration after the last attack? So duration of the last attack, it includes 5 years. 5 years or it is until 21 years of age. So 5 years or until 21 years of age, whichever is longer. So if 5 years is longer, that or till 21 years. Next is the RF. Next condition is rheumatic fever, and there is rheumatic fever along with the carditis. So this rheumatic fever is along with the carditis. So carditis, there is no residual heart disease. There is no residual. There is presence of no residual heart disease. So there is no residual heart disease. That is, there is no valvular diseases. No valvular disease. So there is no valvular disease. So the duration after the last attack is going to be 10 years. So this will be around 10 years and or until the 21 years of age. So it will be 10 years or 21 years of age. Next we move on to the rheumatic fever. So here in terms of the rheumatic fever, so here in the rheumatic fever, this is with the carditis. So rheumatic fever is along with the carditis. So rheumatic fever with the carditis as well as the residual heart disease. So along with the residual heart disease. So this is nothing but the persistent valvular disease. It is a persistent valvular disease. So what is the duration after the last attack? The duration of the last attack, it includes 10 years. So it includes 10 years or until 40 years. So it is 10 years or until 40 years. So whichever is longer, whichever is longer. And sometimes there is a lifetime prophylaxis which is done. So you also provide a lifelong prophylaxis for this. To learn and grow daily like this, please do subscribe.